But I said, no, it's not all about the malpractice, contrary to what might be said. The fact of the matter is, I lost my train of thought on. The fact of the matter is that you're not, the physicians are not going to be able to, they're not going to be able to take this kind of abuse to the extent that they're either going to be able to do what's best for the patient, or they're absolutely not going to have a chance to do what's best for the patient. If, for example, I were going to work for him with family practice and found out about this, the only way I could practice and make a dime would just not be working for him for his family practice. Or what if nobody else needed it, or whatever? What if I just don't work in Winchester? Well, that's okay. If you don't know me, you don't have any loss. But what if you were a patient from before, and I already thought I was going to, and I'm moving? Well, I guess I have to move somewhere else. I mean, this basically affects your life absolutely, total control. Less than 5 minutes, one last thing I'm going to do. I'm going to say about the payments, not the amounts or anything like that, but just how payments work for physicians. Payments to physicians, first of all, when I had a practice and when I did take insurance, you don't debate with insurance companies. They tell you how much they're going to pay. If you insist on seeing their coding, it's a book like that. They don't even want to give it to you. They give it to you under penalty of you not letting anybody know what's in it, and it's what they're going to pay you. Lots of places won't actually give it to you, so you know what the codes will pay you. But what you do is you find out what they're going to pay, and you go, well, it doesn't make any difference. If I don't take that plan, I don't have any patients. Okay? So you take the plan, and you'll find out that some plans, interestingly, pay a lot more for something. That may pay for me to stitch up a centimeter laceration, may pay me $219. And another place pays me $189. Well, it says that they're going to pay you a certain percentage of the amount. So you can figure it out. They're going to pay you 90% of the amount on their tables. It's that. Why do they do it that way? Why don't they just cut all the amounts by 80%? Because those percentages are based on what Medicare pays. If Medicare starts paying less, like they have been, the insurance companies pay less. All they do is change their percentage modifier. So instead of paying $219 times 80%, they pay $219 times 70%. So you get less money. It's the way it works. It's set pretty much by the government. The insurance follows. And you don't have any say on it. Look at it. You get $219 for somebody and $179 for others. What are you going to set as your cost as a physician? Are you going to say, well, 200 is fair, I'll take an average? No. You'll set, guess what, $259. Because you may find out that you'll get on board in the next year with one that pays $249. And the insurance company always writes that they pay the lesser of what you ask or what they allow you. So you put in a big number. It'll be at least as high as the biggest number of all the other insurance companies. And there's quite a range. So guess what? You get all these numbers, if you add it up across the spectrum, the high numbers that you have to go above are pretty much 20% above what you would get paid. Okay? Understand that? You're going to say your legitimate amount you're billing as a doctor is $100, knowing that you're only going to get paid $80. Okay? Now, when you see a private patient as a doctor, you say, well, I feel sorry for the guy. I'm going to have to cut him a break. My charge is $100, but I'll cut him a break. You can't cut him a break. Did you know that? I got to be fair. You can if you write in the record, and you do it very infrequently. And you know why? I love this phrase. I love this phrase. If you do cut too many people a break and you charge them $70, mind you, I'm accepting $80 only from the insurance for something. But I feel sorry for you and we charge you $70 or $60 or $20 or none because I like you. If you do that very much, you can be brought up for $50,000 fine per offense. On what charge? Does anybody know what the charge is? You hear it all the time. No, it's not like that. You hear it all the time in healthcare. If you charge somebody less than you're saying your normal charges, you are guilty of fraud and abuse. Wait, charging less? Yes. Yes. If you charge less, So you cannot charge. Do you ever wonder why it's such a problem with getting high doctor's costs and that the doctors don't cut you a break more? Do you think it's because the doctors are heartless? I won't say it. No. They would be fined $50,000 for cutting you a break, except in the rare cases where they write in the chart, I've talked to the patient, I know the husband just lost a job, blah, 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 I'm going to cut him a break on this. Do you think does that sound realistic to you? It wasn't to me, and I didn't like it. I'll tell you what, this is the really fascinating stuff to me, but it might to you. So I'll stop there. There could be a lot of questions, and I'd like to take questions just off the cuff to show that I'm not totally agenda-oriented. I'll listen to anything you have to say.
Where does the HIPAA?
Thanks.
Where does the HIPAA thing come in that you have to sign with privacy? Are they just completely out the window?
HIPAA, well, it's pretty much out the window because HIPAA was not. It's still there, but it doesn't help you for anything I talked about. Because HIPAA was not written. Now, one thing is in HIPAA that I know about is written to prevent the government from doing anything with the data it wants. Nothing. It just means that I, as a doctor, can't, for example, do X, Y, Z with it. A lot of it was plain old, just made it difficult for me to do things. A lot of times, if I would try to get information from a doctor that I knew I could get, even when I ran my office, I was pretty savvy about these legal things. I talked to them. Their office staff wouldn't give it to me. I talked to their head office staff, and they'd say, we can't give that without a patient consent. I'd say, you're full of crap. You don't know what you're talking about. And understandably, they didn't know what they're talking about because they didn't spend all the time reading the bills like I did. And they were totally wrong. They wouldn't give me information because I didn't have a national provider ID. The government swore up and down when they had those that you didn't have to have that if you didn't use electronic health records. I didn't use electronic health records for anything on the network. Mine was all in my office. I wrote my own program for some of it. Don't let them say you can't have good electronic health records, and don't let them say ones are out there good because I know better. I've written that one. So I can use them, but if I use any of their kinds, anything that goes outside, then I have to have an NPI number to use their electronic health records. Now, since the rules have progressed since then, I cannot see a Medicare patient use my own health care records, because if I see a Medicare patient, I have to have a certified health record one, and you can't get a certified health record one, they wrote, unless you have a national provider ID, so I have to get that. Once you get that, they tag you and your information, and they follow it, so if I make a referral, you don't have to report that you came to me and then went to a specialist. They might want to know that because you may not had to go and I was just being easy on you. I should have stuck it to you and made you suffer. But they're going to know because my NPI matches up with the specialist's NPI. And he has to collect it. That's the law. When he gets a referral, he has to get my NPI if he's in the Medicare program. You see how it's all tied together? It's sick. More questions? Yes.
I have a question. I don't know if you know this. How many sub-agencies have been created under HHS by the healthcare sector?
That's interesting. Doug Racer is a guy that has done a lot of healthcare research even before he did this. And if I have it here, I can remember it's either 157 or 159 different agencies, boards, advisory groups, something like that. That's according to his statistics. Dave Racer, R-A-C-E-R, he's a pretty good guy, pretty smart on it. If you want to know about privacy issues which relate to the health information, I didn't address it with the word privacy, but you can see what's going to happen to your privacy, I think, by what's happening to your information. If you want to know what's going on with privacy issues in healthcare, Google Deborah Peel, P-E-E-L, and I'll have Josh put a few of these links on for things like that on the net if you want. She is all over the stuff when it comes to privacy, and she scares me with what she turns on. Okay.
Question.
Oh, yeah, gun rights and ObamaCare. That's the thing I mentioned about them writing and specifically exempting them, and then all of a sudden saying, this is a great bill. We go for that now. We don't care about you other people. We got our way. will a doctor be able to have patients who choose to pay him, her directly and just avoid government insurance? Well, that's a good question. It doesn't say no. But how many patients would think to do that all at once, within a month, that I as a physician would know, such that I could quit taking the government plan, opt out of it, open up my doors a month later, and know that I'll have more than 4 patients? The doctors are not going to do that. Would you do that if you were a business owner? Would you close up a successful as it can be, practice under the government plan to hope that for some miracle, 2,000 patients a year, that's your database, 2,000 patients you have, not patient visits, your roster of patients averages 2,000 to 2,500 per family practice doc. Are you going to hope 200 new patients or patients show up at your door in a month that want to opt out of the government at the same time? I don't think the doctors are going to take that chance. So the answer from me is, no, you're not going to be able to do it, because who are you going to go to?
You should take the shot.
No, I tried it, and I closed it because my practice was losing money. And that was not as bad as it is now. That was 2 years ago. I don't think it's going to work. This is medical care under socialism, isn't it?
Yeah.
Exactly.
Can you put your email address up down for us?
Yes. The email address should be there, and Dodie can put it on her website, but it's Mark_Berg, B-E-R-G, at Comcast.net. And you can send me comments or ask for information like some of these handouts. I could give you the electronic edition of it.
And if we bring you a chicken, will you diagnose us real quick?
You know, you kind of joke about it, but I wouldn't practice. I'll never go back to practice the way it is. The only reason I would never practice is if it were something like Berger, because I am not going to do it this way.
Dr. Berg,
Yes.
you mentioned about how this affects physicians and how it affects us.
Yes.
How's it going to affect like Blue Cross Blue Shield and people like this?
Health insurance company?
Your health
The
insurance.
health insurance is gone. The flavor, I actually didn't have much stuff, actually, so it's a good question. It's very ambiguous. I didn't have much stuff in there on the health insurance, per se. But the same flavor of the bill, when you see, after I give a lot of examples, you say, yeah, I can kind of see his point. He's not a conspiracy theorist. Basically, this is made to, it will, drive out private insurance. What, have you ever heard of a medical loss ratio? MRR. Everybody in the insurance industry knows what it is. I didn't know what it was. I'm just a stupid doctor. But I found out about a year ago. Yes. I found out about a year ago. It's the amount that insurance companies spend versus the amount they take in on premiums. You take in $100,000 from all your premiums, and you spend $80,000 back to the patient. Your medical loss ratio is, it's either 20 or 80. I think it's 80. It's the one thing you spend back to the patient.